Some COVID-19 patients are still experiencing symptoms months after they should have recovered. They're known as long haulers, and the Pulmonary Wellness Foundation launched an online program to help those survivors with lingering symptoms. Joining me now is Dr. Noah Greenspan, who created the COVID Bootcamp for long haulers. So, Doctor, thank you so much for joining us. I'm curious, tell us a little bit more about the program and where you got this idea from.
Sure. So thank you for having me. This program was designed actually 2 years ago for cardiovascular and pulmonary rehabilitation patients. So with the understanding that so many people really need cardiac and pulmonary rehab but don't have access. So we developed this 42-day boot camp, which, seemed like it would be a perfect kind of plug-in for COVID since everybody was at home. And what we found that was really quite surprising was that even though the program was built for older patients with heart and lung disease, for many COVID long haulers, the program was even too vigorous. So we had to revamp it and kind of scale things back, taking into account the fragile and kind of unpredictable nature of COVID long hauling.
Sure. I mean, the evolution of this virus has been kind of interesting to follow the symptoms and just how so many people are seeming to have lingering symptoms. So how has this treatment program evolved since it first started?
So the program is designed to meet a number of different needs. There are things like thoughts and motivations where I may give you a thought or an idea, a piece of poetry, a piece of artwork that I want you to take into your day with you. It also contains things like breathing exercises, balance, flexibility, strength training, Tai Chi, Qigong, yoga, meditation. And it's evolved basically, in a very, in a way that really has to go day by day. With COVID long haulers, there's so much variability, number one, from patient to patient, and very often within the same patient from day to day. If there's one single rule of, COVID long haul, besides don't talk about COVID long haul, is essentially just take it slow. Like, just don't overdo it. Because a lot of times, people will think, you think to yourself, 4 minutes, how hard can that be? But I've seen patients who are good at 1 minute, good at 2 minutes, good at 3 minutes, and they did 3 minutes and 30 seconds and they wind up in bed for, a week or 2 weeks. That's enough to set them back. So the biggest thing that we've learned is, number one, don't overdo it. And also, we can't pre-plan 6 weeks. So it's like you really have to throw the stone, or more like a pebble, wait for the pool to ripple, wait for things to calm down before moving forward with COVID long haulers.
Sure. I mean, it sounds like patience is obviously important through this recovery process. Are there any other key things you've learned about the recovery process as well?
Yeah. So, I think that, what I've found is that, number one, I don't think there's so much that we could do to speed things up necessarily. I think there's a lot of things that we can do to slow things down or to prevent progress. We know that COVID is a very inflammatory-based condition, and inflammation in one area seems to spark inflammation in other areas. It's almost like an electrical grid where inflammation of the GI system can affect the respiratory system and can affect the cardiovascular system, et cetera, et cetera. So the key is, first and foremost, if somebody is really inflamed, we want to make sure that before we take any steps forward, we cool off that autonomic nervous system. We know that it's a very sympathetic nervous system mediated condition, so it's very fight or flight. People's systems are supercharged. And, in the same way that you wouldn't start to put up wallpaper while the house is still on fire, when people are still in that early inflammation phase, we're trying to do things to quiet the sympathetic nervous system, things like deep breathing exercises, making sure you're getting plenty of rest, meditation, and then at the same time, trying to enhance parasympathetic tone, which is rest, digest, and heal.
Sure. I mean, these long haulers, as we call them, have to be exhausted in so many different ways. What is your number one advice for these long haulers?
My number one advice would be, first and foremost, hang in there. Certainly, I know at the beginning it was really hard for people to get care. There was kind of this idea that people were being gaslighted by the medical system or that they weren't believed. I can assure you, people are aware of long haulers. We believe long haulers. We're doing everything we can to help long haulers. I think it's really important to seek out care from people who do have experience with COVID, because all the things we know pre-COVID is like a totally different planet to what we know post-COVID. So chest pain pre-COVID is not chest pain post-COVID. Shortness of breath pre-COVID is not shortness of breath post-COVID. So I would say seek out a care team that has experience, because COVID is not like anything else we've ever seen. The other thing I would say is, if at first you don't succeed, look for alternative care. There are definitely people out there that are really starting to get the hang of how things go, and how things, can progress with COVID, both positively and negatively. The other thing I would say is that, I'm a general believer that the body knows what to do to heal, and the body wants to heal itself. And I'd say, rather than try to implement too many things at once, too many supplements at once, too many exercises at once, too many medications at once, et cetera, et cetera, et cetera, take things slow, take things one at a time. Most importantly, don't get in your body's way. Give it a chance to do the thing it knows how to do, and basically don't step on it. Just stay out of your own way, and take things nice and easy.
Absolutely. I mean, we got to trust our bodies, and we got to really listen to the experts like you. So thank you so much, Dr. Greenspan, for joining us and sharing your findings on COVID-19. Like you said, we're still learning. Now, we also spoke to a long hauler here in Colorado who is part of Dr. Greenspan's COVID Bootcamp. You can watch the full interview about her experience and find more information about the program on cbsdenver.com.